Hello, welcome back to my channel. My name is Dr. Kathleen Jude Estime, psychiatric nurse practitioner, and I'm here to tell you about disseminated intravascular coagulation, commonly known as D.I.C. I hope you learned something. Like and share if you do. To understand and prepare for the NCLEX and understand disseminated intravascular coagulation, you should focus on the following key points. First, the definition of D.I.C. It's a serious disorder in which the proteins that control blood clotting become overactive, leading to excessive clotting and then bleeding. Common causes are sepsis, trauma, or surgery. Also, obstetric complications, for example, placental abruption and eclampsia. Malignancies and infections, for example, viral hemorrhagic fever. The pathophysiology of disseminated intravascular coagulation, or D.I.C., is a complex and serious clinical condition characterized by widespread activation of the coagulation cascade, leading to both thrombosis and bleeding. Understanding the detailed pathology of D.I.C. involves several key concepts, including triggers, processes, and the effects on the body. So the triggers factors. D.I.C. typically arises as a secondary complication of various clinical conditions. The common triggers include sepsis, particularly septicemia, caused by gram-negative bacteria, trauma and surgery, which is severe trauma or surgical procedure that releases procoagulant substances into circulation, and obstetric complications, conditions like placental abruption, eclampsia, or amniotic fluid embolism. Malignancies in certain cancers can activate the coagulation pathway. Infections like viral infections, influenza, COVID-19, and parasitic infections like malaria can also induce D.I.C. Coagulation cascade activation. D.I.C. begins with excessive activation of the coagulation system. The release of tissue factor, TF, agents that trigger D.I.C., such as endotoxins from bacteria, stimulate the expression of tissue factor from endothelial cells and monocytes. TF, or tissue factor, is a potent procoagulant that activates the extrinsic pathway of coagulation. Activation of coagulation factors. So tissue factor interacts with factor 8, leading to the activation of factor 10 and the generation of thrombin, factor 2A, which converts fibrogen to fibrin. This results in the formation of fibrin clots, formation of microthrombi. As coagulation continues, the widespread formation of small intravascular thrombus occurs. This microthrombi can occlude small blood vessels, leading to ischemia, reduce blood flow to organs, which can result in multiple organ dysfunction syndrome. Organs particularly affected can include the kidneys, lungs, and liver. The consumption of coagulopathy, as clotting factors and platelets are consumed, usually referred to as consumption coagulopathy. Thrombocytopenia, which is when the platelet count drops as platelets aggregate to form clots. The formation of microthrombi depletes platelets across the bloodstream. Prolongation of coagulation tests. Your PTT and APTT are prolonged due to the depletion of clotting factors. Fibrinolysis and subsequent bleeding. The body attempts to break down the fibrin clots through the action of plasmid, leading to fibrinolysis. You're going to see elevated D-dimer levels. D-dimer is a fibrin degradation product that becomes elevated in D.I.C., which is often used as a diagnostic marker. Consequence of bleeding. As the clotting factors are consumed and degraded, this can lead to bleeding complications. Look for oozing from IV sites, surgical wounds, petechiae, purpura, and potentially significant hemorrhage. Multi-system effects. The overall impact of DIC results in alteration in hemodynamics and organ function. You can expect kidney failure due to the decrease in perfusion and acute tubular necrosis. You can expect respiratory issues like ARDS, acute respiratory distress syndrome, and liver dysfunction due to compromised blood flow. In summary, DIC is characterized by a pathological process that involves hypocoagulation followed by hemorrhage due to the consumption of clotting factors and platelets. It is a serious complication seen in various clinical settings, and understanding its pathology is essential for timely diagnosis and management in affected patients. Effective management involves treating the underlying cause, supportive care, and monitoring for bleeding complications. Understand the sequence of events: excessive activation of clotting cascade, the formation of small blood clots throughout the small blood vessels, consumption of clotting factors and platelets leading to a risk of bleeding. In terms of clinical manifestations, you're going to see signs of bleeding as in petechiae, purpura, and ecchymosis, oozing from the IV sites or surgical wounds, and hematoma. Ischemic symptoms and signs of organ dysfunction. Examples are renal failure and respiratory distress, and skin necrosis. In terms of diagnosis and laboratory findings, you're going to see elevated D-dimer levels, thrombocytopenia, which is low platelet count, prolonged PTT and PT, low fibrogen levels. For management, you're going to try to treat the underlying cause, control sepsis, replace fluids, and manage any sources of bleeding. Supportive care may involve blood product transfusions, including platelets and fresh frozen plasma. In terms of medication use, anticoagulants may be used in certain scenarios, but need to be careful in consideration. So nursing intervention, you're going to monitor vital signs and signs of bleeding, administer medication as prescribed, for example, anticoagulants and blood products. Educate the patient and family about the condition and implications and treatment. Maintain strict asepsis and infection control measures, especially for patients at risk of sepsis. In terms of patient education, stress the importance of recognizing early signs of DIC and seeking medical help, understanding the nature of the disorder and the impact it could have on their health. Critical thinking and application. Be able to prioritize nursing interventions based on patient symptoms. Well, thank you so much for listening to my presentation on DIC. I hope you did learn something. If you did, please like and share and place a comment down below.